Turning 65 is a milestone, a new chapter in your life. But as you embrace this moment, there's one decision that could shape your future more than any other. Your first Medicare plan. Choosing the right Medicare plan can feel confusing, even daunting. You've heard the stories, hidden costs, unexpected coverage gaps. But it doesn't have to be this way for you. You deserve to feel confident, informed, and prepared. This is your health, your well-being, your peace of mind at stake. Because when it comes to your health, making the right choice now could change everything. You spent a lifetime caring for others. Now it's time to care for yourself. Let's make sure your next step is the right one. Welcome to your community, Vivek's Wealth and Insurance Solutions, together with Senior 65 Health Plans, where seniors thrive. Join us. What you must know before enrollment starts. We are your senior advocates, Alicia Alfredo and Mona Swan. No senior should ever enroll in Medicare with a stranger. Secure 65 Health Plans, where seniors thrive. Vivek's Wealth and Insurance Solutions. Welcome.
Hello. Fantastic. On the house. 2 p.m. And I'm Alicia Alcano, COO of Vivek's Insurance Solutions. We are thrilled to get you through the essentials of choosing your very first Medicare insurance policy. Mm. Mm. Oh, we're full of golden nuggets. So today we're going to discuss Medicare Basics, 5 major parts of Medicare, how to choose the right agent, what to look for in a carrier, evaluating coverages and premiums, and actionable steps to enroll. Thank you, Monet. Now, Medicare is divided into 4 parts: A, B, C, and I feel like I'm in elementary school again. Each covering different aspects of healthcare. But we're going to make it fun for you. Medicare Part A is hospital insurance. Yay! It helps cover inpatient hospital stays, care in skilled nursing facilities, hospice care, and limited home health care. Most people do not pay a premium for Part A if they or their spouse paid Medicare taxes while working. Medicare Part B is medical insurance. It's covered doctor's visits, outpatient care, preventive services, and medical supplies. Now, Part B requires a monthly premium and it helps ensure that routine medical needs such as doctor's visits and lab tests are taken care of. Now, what is Medicare Part C? It's also known as Medicare Advantage. It's an alternative to original Medicare Parts A and B, and it's offered by private insurance companies approved by Medicare. Now, Medicare Advantage plans often include additional benefits like vision, dental, and hearing, as well as prescription drug coverage, all bundled into one plan. Medicare Part D is prescription drug coverage. It helps cover the cost of medications and is available to anyone with Medicare. You can get Part D either as a standalone plan or as part of a Medicare Advantage plan that includes drug coverage. Together, these parts of Medicare offer a comprehensive healthcare solution to cover a wide range of medical needs, giving you peace of mind as you navigate your healthcare journey. Oh my goodness. It covers certain doctor services, outpatient care, medical supplies, and preventive services. So let's say you're in relatively good health. But lately you haven't been feeling more fatigued than usual and maybe you experience a little shortness of breath. You're concerned, so you call your primary care physician to an examination. During the visit, the doctor conducted a thorough examination, including blood tests, an electrocardiogram, also known as EKG. The test showed that you have an irregular heartbeat, and your primary doctor refers you to a cardiologist, a specialist for more evaluation. Throughout this process, Medicare Part B is playing a crucial role in helping you to cover the cost of your doctor's visit. A specialist consultation, diagnostic test, and outpatient procedures. Part B also contributed to the expense of this prescribed medication under certain circumstances, as well as medical equipment like a home blood pressure monitor. So to summarize, Part B covers medical services outside of a hospital stay. Part B covers doctor's appointment, specialist visits, outpatient care, preventive services, and certain medical equipment. Oh my goodness. Now let's talk about Medicare supplement plans, also known as MediGap, are sold by private companies to fill the gaps in original Medicare coverage, like copayments, coinsurance, and deductibles. Now, a Medicare supplement insurance, also known as MediGap, policy is a private health insurance plan designed to cover some of the costs that original Medicare Parts A and B doesn't pay, such as copayments, coinsurance, and deductibles. Sold by private insurance companies, MediGap's policies fill the gaps in original Medicare coverage, helping to reduce out-of-pocket expenses for Medicare recipients. These policies are standardized and regulated, meaning that each plan offers the same basic benefit regardless of the insurance carrier, although premiums may vary. By purchasing a MedGap policy, individuals can gain more predictable healthcare costs and broader financial protection when assessing medical services. I can hear you. We can hear you. We can hear you. Able to hear you. They're putting comments, so we're good. Absolutely, Monet. So let's talk about Medicare Advantage plans. Are all-in-one alternative to original Medicare. They include Part A and B, and often Part D. These plans combine the benefits of original Medicare, Parts A and B, and often include additional coverage, such as prescription drugs. dental, vision, and hearing services. The advantages of Medicare Advantage plans include lower out-of-pocket costs, comprehensive coverage with added benefits, and the inclusion of an annual out-of-pocket maximum, which provides financial protection against high medical expenses. However, they also come with limitations, such as restricted provider networks, the need for referrals to see a specialist, and varying plan rules that can complicate care coordination. Medicare Advantage plans are ideal for Medicare recipients who prefer having all their healthcare needs managed through a single plan, appreciate the added benefits, and are comfortable selecting providers within a specific network. These plans may offer extra benefits like vision, hearing, dental, and wellness programs. Once again, however, they may have network restrictions. Now let's talk about prescription drug plans, also known as MAPD. It's a plan of type Medicare Advantage that includes prescription drug coverage under Part D, offered by private insurance companies approved by Medicare. MAPD plans bundle all your Medicare benefits into a single comprehensive plan. This means that MAPD plan provides all the coverage of original Medicare Parts, hospital insurance, B, medical insurance, along with prescription drug coverage, and often additional benefits like dental, vision, hearing, and wellness programs. And how it works is when you enroll in a MAPD plan, you're effectively combining your Medicare health coverage and prescription drug coverage into one plan managed by a single insurance carrier. Your MAPD plan administers all Parts A, B, and D benefits, streamlining your healthcare services under one plan with one membership card. Now, remember that there are provider networks. MAPD plans may have specific networks of doctors, hospitals, and pharmacies you must use to receive the lowest cost. This can include what is called Health Maintenance Organization, also known as HMOs, or Preferred Provider Organizations, also known as PPOs. They often have set co-payments and co-insurance for doctor's visits, hospital stays, and prescriptions, which can make your out-of-pocket costs more predictable. And the prescription drug coverage in an MAP plan comes with its own formulary. What is a formulary? A list of covered drugs in pharmacy network, which may affect which medications are covered and where you can fill your prescription. So now if you don't want a Medicare Advantage plan with a prescription drug plan, you can get a MediGap and purchase this in a low Part D, aka prescription drug plan. It is essential to consider your medication needs when selecting a Part D plan, as formularies and cost can widely vary. Now, this plan, PDP, also known as Medicare Part D, can be purchased separately and used alongside a MediGap, also known as Medicare Supplement Policy. Since MediGap plans sold after 2006 do not include prescription drug coverage, enrolling in a standalone Part D plan allows you to obtain coverage for your medications. The combination works as follows. The MediGap policy helps pay for out-of-pocket costs like deductibles, co-payments, and co-insurance under original Medicare Part D and B, while the separate Part D covers the cost of your prescription drugs. This arrangement is used to ensure comprehensive health coverage, minimizing gaps by covering both medical services and prescription medication. And is especially beneficial for those who prefer the flexibility of original Medicare and want to tailor their coverage to fit their specific needs. With the implementation of the Inflation Reduction Act, Starting in 2025, significant enhancements are made to Medicare Part D. You heard it, $2,000 cap on annual out-of-pocket extending for prescription drugs. I love it. Why? Because it's providing greater financial protection against high medication costs. Additionally, the maximum deductible for Part D plans in 2025 is set at $590. Though individual plans may offer lower deductibles or waive them entirely. Now, let's talk about MedMed Plans. Dual eligible. There's another plan to consider. If you qualify Medicare and Medicaid, it's available if you're eligible for a MedMed plan in your state, which can offer additional benefits and lower out-of-pocket costs. These plans coordinate benefits between Medicare and Medicaid to provide comprehensive coverage. Now, say MedMed plans? Yes, they were created to support some of the most vulnerable populations by providing comprehensive, cost-effective healthcare coverage through a combination of federal and state resources. By coordinating Medicare and Medicaid benefits, these plans aim to improve access to care, reduce financial barriers, and enhance the overall health well-being of dual eligible individuals. A MedMed plan, also known as Dual Eligible Special Needs Plan, the SNPs, is designed for individuals who qualify for both Medicare and Medicare benefits, often referred as dual eligibles. Now, dual eligibles are eligible for Medicare, the federal health insurance program, and Medicaid, the state and federal program offering assistance with medical costs. MedMed plans combine the benefits of Medicare Part A and B and often Part D for prescription drugs with Medicaid services. This integration simplifies access to healthcare services. These plans may offer extra benefits such as dental, vision, and hearing, and transportation services that are covered by original Medicare. They include cost sharing and care coordination. MedMed plans often include care coordination services to help manage healthcare providers and services effectively, improving overall health outcomes. Medicare is funded through federal taxes, premiums, and general revenues. Medicaid is jointly funded by federal and state governments, but administered by individual states according to federal guidelines. Now, when it comes to eligibility benefits, the states have flexibility in determining eligibility criteria and the scope of benefits beyond mandatory federal requirements. They may offer services not covered by Medicare, such as long-term care. Let's listen very carefully. Long-term care, personal care services, and home and community-based services. Now, I know that we're having some technical issues on one of our sides. So we'll bring this up as soon as she's able to join us once again. So Jessa, for now, let's go into slide number 10, please. We're going to evaluate carriers. And also remember, the right agent acts as your senior advocate, not just as a salesperson. Now let's look at what to look for in choosing the right carrier. When comparing insurance carriers, consider the following. Reputation is huge. Look for carriers with a strong financial stability and positive customer reviews. Plan options. Do they offer plans that meet your specific needs? Provider networks. Ensure your preferred doctors and hospitals are in network, which is part of the process to do. Customer service. Responsive and helpful customer service can make a huge difference. You don't want to be on the phone forever. Also, consider any additional benefits it may offer, such as bonus programs or telehealth services. Now, understanding cost, would you say, when it comes to coverage premiums, there can be a lot of information that is important to know as we evaluate them. Jessa, slide number 10, please. Let's start by, yes, I can hear you now. So they can hear me, but they cannot hear you. All right. All right, Jessa, let's continue to slide number 11 at this time. So, guys, when it comes to health coverage of premiums, there can be a lot of variations, so it's important to know how to evaluate them. Let's start by looking at the monthly premiums, which is what you'll pay each month just to have the plan. Then consider the deductibles. That's the amount you'll need to pay out of pocket before your insurance kicks in. That's important to remember. Don't forget about co-payments and co-insurance, which are your share of the cost after you have met your deductible. Lastly, check out the out-of-pocket maximums, which is the most you'll have to pay during the policy period before your insurance covers 100% of the remaining costs. By understanding these key elements, better compare plans and find the one that best fits your needs and budget. Now, before we continue moving forward, let's keep in mind, guys, this is a live webinar and technical issues happen. So we're here to support you every step of the way. So not to worry, Monet. We got you, sweetie. Balance is key. Slide number 12. Balance is key with Secure 65 health plans by your side. You can find the perfect stability between cost and coverage without usual hassles. Let's help you navigate the enrollment process confidently and efficiently. Yes, finding the right Medicare plan is all about balance. While a lower premium may seem appealing up front, we all like to save money. It could lead to higher out-of-pocket costs when you need care. It is essential to look beyond just the monthly cost and consider the overall value and coverage the plan provides. Now, let's break it down the enrollment process into actionable steps. Assess your needs. List all your doctors, specialists, and prefer hospitals. Write down all prescription drugs you take. I know someone with 5 pages, including dosages. Determine how much you can afford to pay for premiums, deductibles, and other out-of-pocket expenses. Consider any surgeries or treatments that may affect your coverage needs. Navigating the multitude of Medicare options can be overwhelming. While tools like the Medicare Plan Finder are available, we all use it because it's complicated and time-consuming. This is where Secure 65 Health Plans comes in. We personalize assistance. Our trusted agents, our senior advocates, offer one-on-one guidance, tailor information to your specific needs. Hassles, avoid automated runs, long waits, hang-ups, and technical difficulties. We're your centralized resource for enrollment, simplifying the entire process. By availability, operating in 44 states, we're promptly accessible to assist you, whatever you are. Why choose Secure 65 Health Plan? Selecting the right Medicare plan doesn't have to be stressful or confusing. Our experienced agents are dedicated to helping you understand your options fully. We handle the complexities so you don't have to navigate them alone. With us, you can trust that you're making informed decisions without the usual enrollment headaches. No more guesswork. We provide clear, concise information tailored to you. Secure 65 Health Plans is your one-stop shop for Medicare enrollment and more. Committed to making the process smooth and stress-free. Visit our website to learn or schedule an appointment. We make the difference with our personalized service nationwide. Use the QR code below on the screen to see more information about it and Secure 65 Health Plans.
Okay. Oh my goodness, you guys, we've had such technical difficulties today. It has been crazy. But you know, that's all about going live. All about going live. Alicia, wonderful, wonderful. All I'm going to do is I just want to step in for a second and talk about picking the right agent because I know we were going to do that, but we didn't get a chance to. So if you don't mind me taking a couple seconds just to tell them about why Bivix is and should be their choice, and this is why. So, as the CEO of Bivix Wealth and Insurance Solutions, I cannot emphasize enough that choosing the right Medicare agent isn't just a small decision, it's a crucial step towards securing your health and peace of mind for the rest of your life. Here are some steps that you should take for this year's annual enrollment period. First, avoid calling all call center agents. Avoid it like the plague, you guys. These are massive operations with countless agents, and chances are you'll never speak to the same person twice. Never, 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 never. They're trained to follow a script, focusing on making the fast sale rather than understanding your specific needs. Like, having coverage if you travel out of the country a lot. They don't have time to learn about your individual needs, your concerns, or your goals. This is why your phone call drops. Uh-oh, what happened? Or you're disconnected when you can't make a decision right away and you wonder what happened. It wasn't you. Does this sound familiar? Well, with us, you're more than just a number, and you deserve this personalized attention you have earned over the years. We're not a one size fits all, and we don't give you that one size fits all pitch. Second, steer clear of captive agents. These agents work exclusively for one insurance company. This means they can only offer you their company's plans, meaning they can't and won't tell you if a competitor has a plan that's a better fit for you. So, how does this harm you, you say? Well, you can't make an informed decision. You don't really know what's out there. The Centers for Medicare and Medicaid Services, also known as CMS, requires that all brokers and independent agents provide a clear disclaimer within the first 1 minute of any Medicare enrollment call. The required compliance statement is simply this: we do not offer every plan available in your area. Currently, we represent whatever the number of plans that are there that that specific broker has in your area. They can only say they've got 20 plans, 30 plans, whatever, but they must identify that. So if there's 100 plans and they've only got 45, they've got to let you know that. And then they close with, please contact Medicare.gov or 1 800 Medicare to get information on all of your options. Why does CMS do that? It's to protect you because this disclaimer ensures transparency and informs the caller that the agent may not have access to all of the plans in your area. But what about captive agents? Well, CMS does not require the same disclaimer. So you don't know if there are better plans out there or those that are suited best for your needs, and they aren't going to be able to tell you. It's like going to Target, you guys, and asking the clerk, um, is this that I want available at Walmart and is it on sale? They don't know. They just don't know, right? But you don't know that they don't know. Does that make sense? You don't expect them to know over at Walmart or Target, but you don't know that they don't know when it comes to your healthcare. And that's why it's important. So, this is why we share the different guidelines with you, because captive agents should inform you that they only represent a single company and cannot provide information about plans from other carriers, ensuring that you, the caller, understand their limited scope of options, but CMS doesn't mandate that they do so. So many seniors call captive agents who work for the company who tell them at renewal time, oh, just stay where you are. There are no changes for you at this time, because they can only see what their company has to offer, and you will never know. So that's why you should call us. Call us for the most accurate information about your choices, so that you can choose one of our brokers, our agents, our senior advocates, our financial professionals who truly care about you and your well being. Number three, we don't charge you for our services, and we tirelessly shop around to find the best plan in the market for you, no matter what state you're in, no matter where you live, no matter where you reside. We can find out what's going to be the best plans for you and then help direct you accordingly. Number four, we take the time to ensure your plan fits holistically, considering your budget. Family involvement, we want to make sure your family understands and can support this decision. If you travel, we want to make sure that this plan will cover you if an emergency arises out of the country, and any additional needs like final expense, cancer, heart and stroke, critical care, long term care, home health care, dental, hearing, and vision. You are not going to hear an agent tell you that we only will allow you to buy one dental policies, right? You can buy as many as you want through us because we have several carriers. So listen, you guys, this is the takeaway. We don't just guide you through the Medicare process to get you to the finish line. We're committed to you, to providing you with lifetime value. Number five, our senior advocates and financial professionals are extensively trained in life, health, annuities, long-term care, and financial strategies, because we understand that Medicare is just one piece of your holistic journey. As our client, you'll have direct access to our senior advocates, their business extensions, not a call center, and even, are you ready? Their personal cell phones. So you will always talk to the same person, your representative, every time you call. You don't have to go back and say the same story over and over again. You never have to deal with carriers, long wait times, or even rude representatives or an abrupt hang up if you don't want to. We'll handle everything for you. So, choosing the right agent, well, it starts with us. Got to tell you. Call us and interview us. I want you to be able to interview every agent. Find what's a good fit for you, because we all have different biases and personalities. Find one that you like. We welcome your calls, your questions, and your comments. We want this enrollment period to be not just fraud proof, but a genuinely good experience for you. Your health and your financial well being are too important to us for you to leave it up to chance. Use this AEP to create lifetime relationships with people who care and support your health, not just during annual enrollment period, but for a lifetime. Make the choice that puts you first. Bivix Wealth and Insurance Solutions. And Alicia, what else do you want to tell them about?
Hi, Monez. Awesome to have you back. I love
Good
it.
to be back. Let's talk about collaborative.
So,
You want to?
absolutely. Yes.
Net, play the video.
We have a wonderful video. Yes. Let's play it.
Well, all right.
Collaborative Expansion Foundation, we empower seniors by addressing their critical needs and fostering trusted relationships. We combat loneliness, financial insecurity, and access issues through education, community engagement, and support. Guided by our motto, no senior should enroll in Medicare with a stranger, we strive to ensure all seniors receive the care they deserve. Together, we create a caring, inclusive community.
I also think this is a perfect opportunity to go right into some thoughts and sentiments from some of our dearest and most beloved agents. Play the video, Net.
Hello there. My name is James Price, and I'm a senior advocate and financial professional with Vivix Wealth and Insurance Solutions. And during this time, we understand that residents in disaster areas like Florida and North Carolina and Georgia are facing some travailing times. I want you to know that we're here for you all with open hearts and helping hands, ensuring you stay safe and cared for during Hurricane Milton as well as Hurricane Helene. Your resilience shines through, and we're honored to stand beside you, providing the support you need right now. No matter the challenges, our commitment to your well-being remains strong. You're cherished and protected. And I got a little acronym for Florida, for love of residents in disaster areas. That's what we're doing here for you at Vivix Wealth and Insurance Solutions.
This is Martin Fox with Vivix Wealth and Insurance Solutions. And all of us here at Vivix just want you to know, all of our friends in Florida, and I have many friends in the Orlando area, we just want you to know that you are in our prayers. We're thinking of you, we're praying for you, and we're here for you.
I am Ken Thayer with Vivix Wealth and Insurance Solution. You are valued and loved. Please reach out to us for any support. We are here for you.
Boy, that's great. And let me just also say this, you can see that we care and that we offer personalized assistance, and it extends to everyone, wherever you are, not just with Medicare, but with other services. So let me take this time to say happy birthday to Joe. Hope this is one of your best. You're not old enough to really be one of us seniors, but we'll adopt you into the crowd just for today. So for everyone else, please reach out. Feel free to call us about any circumstances that you're struggling with so that we're able to give you that personalized service that you deserve. Alicia?
And yes, don't forget to like, share, and subscribe to our Secure 65 Health Plans YouTube channel for more informative content. You can always call us at 833-300-4968. Email us at info@vivix.com. Visit our website. Use the QR code. We're in all social medias: Facebook, YouTube, LinkedIn, Spotify, Patreon, Instagram, and more.
So in closing, thank you for your patience today with us with our technical issues. But I want to tell you, I'm taking the advice of this quote today. In closing, do something today that your future self will thank you for. Our actions and decisions today will shape the way we will be living in the future. Alicia?
I want to thank you for all joining us today. And here's to your health and peace of mind. See you same day and same time next week with no technical issues.
And yes, and thank you everyone for taking out the time to be with us. We will see you on the same Trusted Senior channel on YouTube. And remember, true peace of mind, well, it comes from trusting your health and financial needs are covered. So with Secure 65 Health Plans and Vivix by your side, you're free to enjoy every day knowing that we've got your back. So stay happy, stay safe, and stay golden. I'm Monet Swan.
I'm Alicia Alcano.
Bye.
Bye for now.
As you embark on this new chapter of your life, your health and peace of mind are more important than ever. Choosing the right Medicare plan isn't just about coverage. It's about securing the care you deserve and ensuring the comfort of your golden years. We understand that navigating Medicare can feel overwhelming, but you are not alone. Take the time to explore your options. Ask the right questions and seek the support you need. Your well-being is worth every effort. And making an informed choice today can lead to a healthier, happier tomorrow. Your journey to the right Medicare plan starts now. Take that first step with confidence and peace of mind. Vivix Wealth and Insurance Solutions, together with Secure 65 Health Plans, where seniors thrive. We are your senior advocates, Alicia Alcano and Monet Swan. Come be a part of our community, Secure 65 Health Plans. Join us October 15th through December 7th. That's our Medicare open enrollment period. Call us and drop off your ANOP or send it to us. We are the vision. We are disruptors. We are changing the way seniors do business. Become one of us. We are your community. We are here for you. No senior should ever enroll in Medicare with a stranger. Call us today at 213-394-8885 or 833-300-4968. Or email us at info@mybivix.com. Secure 65 Health Plans, where seniors thrive.